All right. Hi, everyone. Thank you all so much for joining us for today's webinar. We've got a lot to cover today, so we're going to jump right in on budget reconciliation and what we might expect from the next few months in Congress. And so the things we'll cover today is we'll go over the basics of budget reconciliation and what to generally expect from this time around. We'll look into some of the proposed policies that are being floated by Republican leaders. We'll talk a little bit about what we're watching for and how to get involved. And then at the end, we will leave some time for questions and discussion. So just off the basics, reconciliation is a part of the budget process, and it's a procedural rule that allows for the expedited consideration of matters pertaining to the federal budget. And so one of the main features of this is that it allows the circumvention of the Senate filibuster, which usually requires 60 votes to break. Under budget reconciliation rules, that is brought down to a simple majority of 50 votes. And so given that Republicans have taken back control of the Senate with their 53-seat majority, this is a pretty important measure for passing much of their legislative priorities. And so House Speaker Johnson is expecting to get a lot of these policy priorities and a budget reconciliation bill passed by May, probably around Memorial Day is what they're planning for. And there's going to be a likely chance of a lot of health policy going on in this bill, both in terms of new policies as well as a lot of cuts to health programs as well. And this is coming from Energy and Commerce Committee Chair Brett Guthrie. And for a little bit on the timeline, let's hear from Republican Majority Leader Steve Scalise. And a transcript of this clip is below for you to follow along as well.
Resources. This time we're going to have at least 8 to 10 committees involved, Larry. That's a lot of different members, a lot of different committees that are going to be working. So we have to do the budget first. And we've said by February we'll have that done. That means March. The month of March, you just go draw it up on your calendar. You're going to see 8 to 10 committees in Congress working feverishly to find waste, fraud, and abuse, to identify real savings. And I'm talking not tens, I'm talking hundreds of billions of dollars of savings from some of these committees where they're going to be able to put real reforms in place.
And so in some of the basics, this is a pretty complicated procedure, and we're going to go over just some of the basics. I think this is really important to talk about because especially when there's something that's procedurally complicated, there are a lot of opportunities to get involved in the process, as well as a lot of inflection points that can really influence the outcome of the actual policies that end up getting passed and potentially signed into law. And so this is a diagram pulled from the Congressional Research Service that shows the general timeline of a budget reconciliation process, which first starts with a budget resolution, which is only passed by Congress. It's not signed by the president, and it's the form of a joint resolution that expresses some general sense of the Congress. And that resolution instructs certain committees to report legislation within the specific budget amounts that is laid out by the Budget Committee. And usually, especially in this case, this is going to be coming from a lot of different committees. And so those will oftentimes get packaged together into a single omnibus bill. And then they're considered on each of the floors, both in the House and Senate. Differences are resolved, and it's enacted into law, similar to the general legislative process. And as I mentioned, this is an expedited procedure. It allows for a lot of the normal roadblocks, especially in the Senate, that it kind of lifts those up and allows for this to go through. And so there's one of the big things is that there's a vote-a-rama, which occurs during the amendment process, where a lot of amendments can be offered in a generally short period of time. And then those amendments are voted on in rapid succession. And we'll talk a little bit about that later. Like I'd mentioned, points of order are an important part of this procedure. None of the rules of Congress are self-enforcing. They have to be actively enforced by other members. And so anytime there is a question as to whether a move is procedurally valid, a point of order is raised, and then whoever is chairing the floor will make a ruling, oftentimes in consultation with the parliamentarian. And then if the Senate or the House wants to overturn that ruling, they have to vote on that as well. And so this is a pretty important part when we go to the germaneness as well as the limitations placed around amendments that make this an expedited procedure. And so the specific limits come from a rule called the Byrd rule, which puts some guardrails along what certain provisions are allowed to be added into a bill and what can't be. And so part of the process when you go through this vote-a-rama, this rapid succession of amendment voting, is that there's going to be a lot of rulings on whether an amendment or provision is extraneous or eligible to be included in the resolution. And so this is another important piece that, again, if you want to overturn it, then there's really no point in doing it in the reconciliation process, because if you have the votes to overturn a ruling of the chair, you can probably then just pass it through the normal legislative process instead. And so this is the six orders that are used to determine whether or not a provision is extraneous. I won't read them all out, but we will send over the slides later. But some big ones include that leading to an increase in outlays or decrease in revenues, or does not result in changes to outlays or revenues, or it is just merely incidental to that. And so really what these provisions have to focus on is the budget. It has to focus on spending, and it has to focus on specific quantifiable amounts. And so that's oftentimes why provisions will get struck down on a point of order. And because this is part of the Byrd rule, this process is often referred to as the Byrd bath, because it has to go through this process of ruling whether or not it is extraneous. And so now that we've gone over some of the procedural considerations for the budget reconciliation process, let's look at some of the policies that are being considered for this time around. Over the past few weeks, we've seen a few documents being circulated by members of the House Budget Committee. These are, quote, policy menus. These are not a list of the actual policies that are going into the bill yet. Rather, I want to emphasize that this is just some of what is being considered by these committees, and that we won't really know the specifics until we get the text of these bills later on. But we can see from now what some of their priorities are, where they're looking to cut spending, and how much spending they're looking to cut as well. And so the one on this screen was released about 2 weeks ago from one of the members of the Budget Committee. It's pretty top level, and it doesn't really have much descriptions beyond a title and a dollar amount. However, last week we got a more substantial document from the chair of the Budget Committee. I'll put it in the chats for folks to take a look at themselves. It's about 50 pages, and so it's it's much more in depth, and it covers a lot more policies than was in the original menu that we saw from a few weeks ago. So starting off, look at some of the telehealth policies that are being considered. One is to pass the Preserving Telehealth Hospital and Ambulance Access Act, as it was reported out of the Ways and Means Committee this past May, which would have extended many of the COVID public health emergency waivers for telehealth. And in this document, they estimate a cost of $20 billion in 10-year costs. But it's important to note that they're not really citing any of their sources, nor are we aware of any Congressional Budget Office estimation of this. And so we're still really trying to figure out where this number is coming from. Another policy being considered is banning telehealth facility fees, which would prohibit hospitals from billing facility fees for telehealth services and for certain other outpatient services, which is expected to be a $2.3 billion cut. Another policy being considered is telehealth-only COBRA coverage, which would allow the offering of a telehealth-only option for COBRA continuation coverage within the existing employer's health plan. Not all of these came with a budgetary impact, whether in terms of cuts or increased spending, but these are still being considered by the committees. Similarly, another bill that's being considered is one to allow employers to offer standalone telehealth benefits to all employees, including employees who are eligible for enrollment in their employer's group health plan. And so these are listed in that 50-page document that I shared. They're just listed as adopting the bills straight up as they were introduced or passed in their committee. Another big policy that's being considered is site-neutral payments, where Medicare would pay the same service regardless of site, whether at a physician's office, ambulatory surgical center, or importantly, hospital outpatient. The MedPAC has recommended expanding this. However, hospitals argue that it would reduce access to care, it would bring in less revenue for hospitals, and it could include and impact telehealth services. And so the committee is considering this to be a over $146 billion spending cut for Medicare. Another policy that's being targeted is Medicaid expansion, which was originally introduced under the Affordable Care Act, which provided for additional funding for expanding Medicaid eligibility. This is, of course, referred to as Medicaid expansion. On this slide, you can see a map of states that have expanded Medicaid and adopted the provision, as well as states that have not. The proposal being considered by the Republican Party would cut the 90% federal matching reimbursement for the expansion population and would result in an estimated $561 billion in Medicaid spending. It's also important to note that even though this doesn't directly affect telehealth, this will still have an impact. One study we found indicated a 54% increase in telemental health utilization in expansion states when compared to non-expansion states. And so this would represent a significant cut of spending on health services. Another cut being considered for the Medicaid program would be a per capita cap, which would convert the Medicaid funding model to instead be based on the size of the state's Medicaid enrollee population and would not instead be in line with its health spending as it's currently implemented. And so this graph on the right shows states that would have exceeded a per capita cap in at least 1 year in the span of a few years. And so this would represent a pretty significant cut to Medicaid funding. They're estimating $900 billion in cuts over 10 years to the Medicaid program. And another cut being considered is the federal medical assistance percentage floor, which is currently set to 50% of the federal government's share of Medicaid expenditures. And so in this policy document, they very directly say that this policy is targeting higher income states like New York and California. And so the proposal would be to lower this floor below 50%. This would also include a specific carve-out for DC, where it would remove its current FMAP percentage rate and instead put it at this floor as well. Another policy being considered for is the reduction of Medicaid provider taxes, which states use to help fund their Medicaid programs. And so they're currently at 6%. However, they're proposing a 2% decrease for the next 2 years, and then a down to 3% from 2028 onwards. Another policy being considered is reducing coverage of bad debt, which is a term generally referred to debt that hospitals and other clinics can't collect from patients. And so this would reduce how much Medicare would cover and pay for that as well. One thing that's notably being left out of the conversation is the debt ceiling. And so their leaders in both the House and Senate, but particularly in the House, are not confident that having debt ceiling in the budget reconciliation process would be able to clear the votes needed to make it through the chambers. And so they're considering doing another bill addressing that separately. This, of course, is a priority for the new administration and Congress, given that it is projected that the US will start to get close and potentially hit the debt ceiling this year. This would have a pretty big impact on federal health programs. It would likely result in delayed Medicare and Medicaid payments. It would make capital investments more costly. And if it results in an economic downturn, this may lead patients to defer care, resulting in less income again for health systems. Another important piece of this that we're keeping an eye on is telehealth waivers. As I'm sure you all know, the current continuing resolution that's funding the government is only valid until March 14th. And so with the current timeline that the Speaker of the House is estimating, then a budget reconciliation bill wouldn't be passed until later in May. And so there's a few options that could potentially resolve this for Congress to keep the government open, which would either be to finish and pass the reconciliation bill before March 14th, which is probably not likely to happen given how big and substantial we're expecting it to be. Or the more likely option would be to pass an additional CR, continuing resolution, to keep the government funded while the reconciliation bill is worked on. And so while we have no indication that telehealth would be cut, again, this is another opportunity for, if it does potentially get dropped, then we could see a lapse in a lot of the telehealth waivers that much of the community has come to rely on. And so what are we watching on? One of the big things is, do they have enough votes? This is especially important in the House, given that the Republican Party has a very, very small majority and can only afford to lose less than a handful of votes on any bill. And so this is really what's driving a lot of the conversations about what's going to go in the bill and what's not going to go in the bill, because the Republicans need to get this through the House. And if they don't want to have to rely on cutting a deal with Democrats, then they're going to need pretty much their entire caucus on board. And so this is going to be one of the big bottlenecks for any policy coming through the House in the 119th Congress. The margins in the Senate are a little less small, with 53 to 47 margins for the Republicans, which means that they have the votes to get this through the reconciliation process without needing any support from the opposition party. And they also have 1 or 2 votes that they can spare on this as well. And given that their party also won the White House, they do have the tie-breaking vote as well. So that's one of the big things that we're going to be keeping an eye on is, can the Republican Party keep their conference together to pass this bill? There are other key inflection points that can affect the outcome of this bill as well. One of which is the Budget Committee deliberation, which we're seeing happen right now as they're drafting some of their options and priorities for the upcoming bill. Many of the procedural hurdles that are involved in the reconciliation process, including the instructions being sent to committees, the reports that the committee send out, the votes on the floor, and many others. And again, as I mentioned, the Votorama, which allows for the proposal and voting on of amendments to a reconciliation bill in pretty rapid succession in the Senate. if you recall from the early months of the Biden administration in 2021, a similar process played out during the deliberation of the American Rescue Plan, where senators were on the floor introducing and voting on amendments until late in the night, and many of which made through, others did not. And so this is likely also going to happen during this budget reconciliation process as well. So that's all I have in terms of content for this. I'd love to open it up to questions or any additional comments that folks in attendance may have as well. And while we think of any comments or questions that we have, I also just want to make a quick shout out for the Digital Health Tech and AI Showcase. Registrations are still open, and you are certainly more than welcome to register as a presenter or save the date to attend as well. And we are also still taking nominations for the CTeL AI Trailblazer Award, which you can submit to us as well through the end of the month too. Yep, I can put the link in the chat for you all.
Aloha, Lydia. It's Chrissy from
Hi.
Hawaii. Hey, Happy New Year. My only question is, this is a lot for me to digest, but is there anything that I can do at my local level, like with, our senators, like our, Brian, Senator Schatz, any of our folks that are there at the White House that I can, write them letters or advocate for, and if, something that I could ask them to help support, and if you folks have templates or anything that I could use. Great
For sure.
presentation, by the way. Thank you.
Thank you. Yeah, and so because a lot of this is going through Congress, one of the best things you can do is set up a meeting with your member in their office to tell them about the importance of a lot of these telehealth measures to ensure that they're included, because there's a lot of priorities going into this bill, and so something like telehealth isn't always top of line, especially when a lot of the party's big messages are surrounding things like immigration, energy, and other priorities. And so it's important to always keep the importance of telehealth at the forefront for these members and their staff. So that's a really important way that you can just call, write, or meet with your representatives and your senators to make sure that they're keeping this top of mind. Another thing too is, of course, the impact of any cuts to Medicaid and Medicare funding, to help kind of illustrate how that might affect the patients that you work with, and your practice and access to healthcare. Oftentimes, members of Congress really value hearing stories from their districts and from their states, and those can really help them in ensuring that some of their priorities are seen and heard on the Hill.
Great. Mahalo for that.
Any other questions or comments? If not, you're more than welcome to always reach out to me by email, which I put in the chat. Great. Well, thank you all so much for joining us this afternoon. We will continue to keep you all updated as we hear new developments coming from Congress on this, and we look forward to working with the community in 2025. Have a great rest of your day.